5 years after COVID crisis. China faces new virus outbreak? Media reports make big claims. Did China declare state of emergency? Are hospitals overwhelmed in China? But the bigger question is, what is the human metapneumovirus? What are the symptoms? And how can we prevent the spread of this virus? Several media reports have claimed that China is currently facing an epidemic outbreak of human metapneumovirus, or HMPV. Many social media posts suggest that the disease is spreading quickly and mostly affecting children and the elderly. One social media post claimed that China has declared a state of emergency as the so-called epidemic has overwhelmed hospitals and crematoriums. However, there is no official confirmation of this. In addition to HMPV, other viruses are reportedly spreading across the nation, including influenza A, Mycoplasma pneumoniae, and COVID-19. The human metapneumovirus is said to spread rapidly, 5 years after the COVID-19 epidemic. While there is no official statement about HMPV being an epidemic in the country, the virus does exist. Here's what you need to know about the HMPV virus. Human metapneumovirus is a virus that causes symptoms quite similar to common cold. In usual cases, causes cough or wheeze, runny nose or a sore throat. However, it can be particularly severe for young children, the elderly, and those with compromised immune systems. When it comes to symptoms, HMPV initially presents as an upper respiratory infection but can escalate to more serious conditions, including pneumonia and asthma flare-ups. According to the U.S. Centers for Disease Control and Prevention, HMPV was identified in 2001 and falls within the pneumoviridae family, which includes the respiratory syncytial virus. As per the CDC, symptoms of HMPV infection could progress to bronchitis or pneumonia, and are similar to other viruses that cause upper and lower respiratory infections. To prevent the spread of human metapneumovirus, health officials urge frequent hand washing with soap and water for a minimum of 20 seconds. It's also vital to refrain from touching the eyes, nose, or mouth with unwashed hands and to maintain distance from individuals who are ill. Those exhibiting cold-like symptoms are encouraged to wear masks in public spaces or when coughing and sneezing. Prioritizing hand hygiene is essential in these challenging times. Remember, currently there's no specific antiviral treatment for HMPV. No vaccine has been developed either. General supportive care is given to address the symptoms.